up, y'all? This is Kia Chisholm with episode 5 of Dr. M's 10-part series. And today we are talking about lateral epicondylitis, better known as tennis elbow. Now, tennis elbow can be defined as an irritation of the tissue connecting the forearm muscle to the elbow. It is basically a tendonitis where you feel pain in both your arm and you feel it in your elbow regions. Now, it's pretty common for you to develop tendonitis or lateral epicondylitis, aka tennis elbow, from doing repetitive arm and hand movements, especially if you're in a career that forces you to grip constantly or to type constantly, anything that has repetitive movements throughout a long span of time. Now, tennis elbow is actually one of the most common issues or conditions that develops pain in your elbow. And you're gonna feel pain most often whenever you're shaking your hand, you grip your hand, or you're making a fist, if you raise your hand, or if you're lifting, especially if you have improper lifting techniques. Now, those that are more likely to develop tennis elbow are those over the age of 40, typically, those that practice improper lifting techniques, and those that are in professions, again, like carpentry, painting, typing, etc., or if you play sports, or if you're a professional athlete in sports like tennis or racquetball. Again, we've got all the background information out. Getting straight to a couple exercises that'll help you be able to treat your tennis elbow at home. I'm going to turn to my side. You're going to take your hands, palms facing upwards. You're going to grip them. And at this point, you're going to curl your wrist forward. Then you're going to reverse for the second exercise, and you're going to curl downwards. And the last exercise that you can do at home is to get a towel and to practice twisting the towel. Now, for physical therapy options, you have about 4 basic options that include ice, ultrasound therapy, massage therapies, or getting an elbow strap to help take off some of the tension while you're walking around. And it's also going to help you prevent from making those constant arm and hand movements that lead to the development of tennis elbow. Now, for tennis elbow, you also have chiropractor options. These include active release therapy, dry friction therapy, dry needling, and acupuncture. Now, the best part about tennis elbow, even though it is a condition that brings you pain, is that your worst case scenario is going to be physical therapy or going to the chiropractor. You do not need to go through any surgeries to help treat your tennis elbow. Now, a couple stretches that you can do would include some elbow and some wrist stretches. So you can take your hand, place it this way, and take your other hand and just bend it downwards. Bringing it forward. Same thing for the other side, downward. You're gonna feel the stretch all right here. Downwards, backwards. You can also take your elbow upwards, stretching here, stretching the muscles that are also connected to your elbow to provide some sort of a relief. And then the last stretch will be your classic crossover arm. You can hold all of these stretches for about 30 seconds to a minute at a time, and then maybe do them about 3 times per day. And then for your strengthening exercises, as always in every other video, the recommendation is 3 sets of 10 reps. Now, this is episode 5 over lateral epicondylitis, aka tennis elbow. Again, I'm Kia Chisholm, and I'm going to catch y'all in episode 6.